To University of Calabar pre-degree digital lecture series. I'm Dr. Basi Etagbo. I will be presenting on humans and environment. For the part A of this lecture series, I'll be looking at the humans, diseases of human importance, and the objective of this lesson is to identify the ecological conditions that favor the spread of common endemic and potentially endemic diseases in the tropics. We will also relate the biology of the factors or agent of each disease with its spread and control, so that if we know the agent or the vector of the disease, if we can control the vector, then we will be able to control the disease. Then we look at common endemic diseases in Nigeria and the tropics, and we look at easily transmissible diseases and their disease syndromes. Let's go straight to our lesson. These diseases of human importance are caused by tiny microscopic creatures that we cannot see with our naked eyes. The invention of microscope opened up the world of very minute living organisms called microorganisms. They are commonly known as germs or microbes. They are found almost everywhere in nature. Some authors say they are ubiquitous, meaning they are found in air, water, soil, and surfaces of objects and living organisms. They are found on you, the student. They are also found in living things where they are able to invade living cells, causing one infection or the other. They are commonly dreaded as disease-causing agents. Now, microorganisms do not cause disease. Some of them are beneficial, as my colleagues have taught you people. The one that causes diseases are known as pathogens, and they are mainly parasitic microorganisms. When these pathogens enter the body of a host, they do not produce the signs and symptoms of the disease immediately. They have to fight the host's defense mechanism, establish itself in the host's face. Then there is a period whereby they fight the host's body mechanism and establish itself. This period is known as the incubation period. It is this incubation period that this pathogen grow and multiply inside the host, weaken the defense mechanism of the host, and then take over the body system of the host. At that point, they will now cause the disease or infection in the host. After the incubation period, the host will now manifest the signs and symptoms of the diseases the causative agents and carries. This is the disease period, and the host at this point is infectious. Now, these microorganisms, they harm us in two ways. First, by causing food spoilage and by causing diseases. How do they cause food spoilage? Now remember, this food you eat is rich in nutrients that will nourish your body, build your worn-out tissues, provide energy, provide you vitamins. These microorganisms also need that same nutrient for their growth. So if the food is not properly handled, and these microorganisms, remember we said they are ubiquitous, they are found everywhere, found in the air. So if food are not properly handled, they will rest on your food. Use the nutrient in the food to flourish and multiply in your food. So by the time you go to eat it, you are unknowingly inoculating yourself with the causative microorganism from your food. And the next one is when they get into you via your nostril, your mouth, and other parts, causing this disease directly inside of you. The important type of disease causing or pathogenic microorganisms in humans are the viruses, bacteria, protozoa, and fungi. We'll briefly look at these four groups of organisms. Pathogenic organism causes infectious and communicable diseases. What are communicable diseases? Communicable diseases here are diseases that can be spread from one person, an infected person in this case, to a healthy person. This is because these pathogens are parasitic. They have to find a way of moving from one host to another. Now, these microorganisms can spread through air. So the ones that move via air are known as airborne pathogens. Then some are spread through water, and then those ones are known as waterborne pathogens. Some via food, as I've explained, those ones are known as foodborne pathogens. Some microorganisms also can be spread via direct skin contact or through animal vectors, such as your tsetse fly, mosquitoes, and others, name it. Now we look at the first one, spread through air. Many disease-causing microorganisms are light and have light spores, especially your fungi, which can easily float in air. These airborne pathogens enter the body of a host in the air he or she breathes, through his nostril or through the mouth. They often affect the nose, throat, trachea, bronchi, and lungs. Now, these pathogens, when they have established itself in the lungs of this person caused disease, how do they live? They leave the body of the infected person in droplets in the air that the infected person, now in this case, breathes out when he or she sneezes, cough, and spits. Diseases like pneumonia, tuberculosis, influenza are caused by airborne pathogens spread through water. These are pathogens that get into its host by when the host takes in contaminated water. The waterborne pathogens enter new hosts through their mouth. They often affect the intestine of their host, causing diarrhea, and they leave the body of their host through their feces. Now, in places where sanitation and personal hygiene are poor, drinking water can become contaminated by such infected body waste. Like in rural area where there's no proper sanitation and people are doing surface defecation, runoff will take this pathogen into water bodies where they drink from. Now, spread through food. Pathogenic microorganisms can be spread by eating contaminated food, as explained earlier. Like waterborne pathogens, foodborne pathogens enter and leave the body of the host through the mouth and in the feces and urine, respectively. Foodborne pathogens also affect the intestines. Food becomes easily contaminated when handled by infected person or carrier who have poor personal hygiene habits. Foodborne pathogen can also get into the host by contaminated water. When contaminated water is used in preparing the meal, or by animal vectors like fly, when fly perch on feces and then rest on food that human will eat. So with that, they spread the foodborne pathogens. Now, food like milk and ice cream are some of the most common sources of infection, as pathogens can multiply rapidly in this food. When milk and ice cream are not properly handled, remember I said the same nutrient the milk and ice cream gives to your body, that same nutrient also help for the survival and proliferation of microorganisms. So if our ice cream not properly handled, if our meat are not properly handled, microorganisms can infect it, proliferate, grow, and contaminate it. So when we now go to take our dear milk and ice cream, unknowingly we'll be inoculating ourselves. Now, diseases like bacillary dysentery, amoebic dysentery, salmonella food poisoning, and cholera are caused by foodborne pathogens. Now, we move on to spread through direct skin contact. Certain pathogenic microorganisms are spread from one person to another by direct physical or skin contact. The diseases they cause are known as contagious diseases. Contagious in the sense that once there's a body touch, they will move from the infected person to the healthy person. Then they will establish itself and cause that same disease condition to this healthy person. Physical contacts occur in crowded places when playing games and during activities like kissing and sexual intercourse. During the using the personal things of a person with contagious disease can also cause infection. Contagious diseases usually affect the skin and mucous membrane. Now, leprosy, ringworm, syphilis, gonorrhea are examples of contagious diseases that are spread through direct skin contact. Then spread through animal vectors. Animals, especially insects, can spread disease-causing microorganisms from person to person. Examples of such insects are mosquito that spread Plasmodium species, the causative agent of malaria, and tsetse fly is another vector. How pathogen causes diseases. The microbial activity of pathogens. Now, when these microbes get into our body, they will carry out their physiological activities inside the host. Now, their microbial activity here produce the signs and symptoms of a given disease. Symptoms of a disease are due to changes in the normal body functions. Pain, fever, headache, coughing, vomiting, and paralysis are all symptoms of diseases. Signs of a disease are the outward appearance of a disease, such as rash, swelling, edema, and diarrhea. That's the difference between symptoms and signs. Cause of a disease. When pathogens enter the body of a host, they do not produce the signs and symptoms immediately. They have to fight the host, defense mechanism establish itself, there's an incubation period, then the signs and symptoms manifest, then the disease will come forth. Then at this point, the host is infectious. Then finally, the host may overcome the disease. How will the host overcome the disease? If the immune system is able to overcome the host, combat it, then the host will overcome the disease without taking treatment and without taking any drugs. This is the recovery period. Some diseases like influenza and mumps, they have short incubation period, while others like syphilis have long incubation period. Then the table 1 here shows some diseases of human which we'll be discussing in our lesson. Now, for the viruses, we have smallpox, measles, chickenpox, poliomyelitis, common cold, rabies, hepatitis A and B, and AIDS. Then we'll see the method of spread and the causative agents. For smallpox, causative agent is pox virus. For measles, paramyxovirus. Then for rabies, rhabdovirus. Then for AIDS is human immunodeficiency virus. Then we look at the next group, bacteria. Disease of importance are cholera, typhoid, food poisoning, tuberculosis, whooping cough, gonorrhea, syphilis. And we've seen the causative agent here for cholera is caused by Vibrio cholerae. Then for typhoid fever, causative agent Salmonella typhi. Then for food poisoning is Salmonella. Then tetanus, Clostridium tetani. Tuberculosis, Mycobacterium tubercle. Then we look at the next group, protozoa. The diseases of importance are amoebic dysentery, sleeping sickness, and malaria. Amoebic dysentery is caused by Enteromoeba histolytica, while sleeping sickness is caused by Treponema brucei cambiis, while malaria is caused by Plasmodium species. Then for the fungi, we'll be looking at dermatophytes. Disease of importance is disease of importance we'll be looking at basically eczema, athlete foot, and others. We'll quickly take the first disease of human importance, cholera. Cholera is an infectious disease caused by a bacterium which infects the intestinal tract of human. Method of spread is food, via food, or contaminated water. How do we contact them? Through food. We get infected if one eats raw or partially cooked seafood or contaminated water. The causative agent of this disease, cholera, is a gram-negative comma-shaped rod known as Vibrio cholerae. The bacteria is found in water contaminated by infected feces from cholera person. They enter our body when we take in contaminated food and water, or come in contact with the feces, urine, or oral secretion of infected person. The disease can also be spread by the housefly. So you see, this one disease here can be transmitted via a vector, that is the housefly, can be transmitted via contaminated water or contaminated food. This is a picture of the causative agent of cholera, Vibrio cholerae, a comma curve-shaped microorganism. Symptoms of cholera. When the bacteria reach the intestine of its hosts, they multiply rapidly and secrete an enzyme known as murinase. This murinase digests the mucous lining of the intestinal membrane. The exposed cell wall becomes damaged by the endotoxins so produced by our Vibrio cholerae, resulting in severe diarrhea, usually accompanied by acute abdominal pains and vomiting. The feces are watery and full of bacteria. Now, the feces produced by the infected person is known as rice water stool because of its appearance. Owing to the frequent and large quantity of water lost in the feces, the patient becomes severely dehydrated. The patient lost lots of water, such that if left untreated, death occurs in less than 24 hours in extreme cases. Now, how do we treat cholera? The main treatment for cholera is to prevent dehydration of the body. And now, once we notice that our friend or relation is vomiting and stooling at the same time, the first thing is to replace the water loss via ORS or intravenous injection of saline solution into the vein, so that the patient will regain moisture in the cell. This is done by injecting large volume of saline solution into the vein of the patient, so that water content of the cell is brought back to normal. Now, prevention and control. We can prevent and control this infection by vaccination. Vaccination, however, gives temporal protection of up to 6 months, which is not reliable. Now, the following method can be used in the control of cholera. First, proper sanitation habits should be observed to prevent drinking water from becoming contaminated by infected urine and feces. That's why those that do borehole are advised to drill their borehole some meters away from soakaway to avoid seepage from the soakaway to the borehole. So proper sanitation and habits should be observed to prevent drinking water from becoming contaminated by infected urine and feces. The cholera bacteria are easily killed by heat. Therefore, drinking boiled water and eating thoroughly cooked food prevent the infections. But some people will say, oh, I prefer half done. No, food should be properly cooked, especially marine animals should be properly cooked before consumption. Cholera patients should be kept isolated in hospitals, and their personal article must be thoroughly disinfected. Since the common housefly is a vector of the disease, measures should be adopted to discourage the breeding of housefly around our area. And also, we should always keep cooked food covered. With that, we've come to the end of the first disease of human infection, cholera. We move to the next one, tuberculosis. Tuberculosis is caused by an acid-fast bacilli known as Mycobacterium tuberculosis. Tuberculosis is prevalent in the developing countries of Asia, Africa, and South America. It is one of the commonest causes of illness and death in this region. It is a rod-shaped, non-motile, and hardly resistant to adverse conditions. This Mycobacterium tuberculosis, the causative agent of tuberculosis, can remain alive in dust for several months. In humans, now mode of transmission. In humans, the mode of transmission is by droplet infections through coughing, spitting, and sneezing by patients. So we stand or relate with an infected person. So when the person coughs, spits, and sneezes, an aerosol generated, and we inhale the aerosol so generated, the healthy person will contact the disease. Tuberculosis can also be spread by handling objects contaminated with the saliva or sputum of patients. It can also be contacted by drinking unpasteurized milk of infected cow. Symptoms of tuberculosis. Tuberculosis may occur in the lungs, in the spleen, liver, and other organs. The most common forms, lungs or pulmonary tuberculosis, usually starts with a dry cough, followed later by the spitting of blood-stained sputum. The bacteria initially establish itself in the lungs, multiply, and develop into tubercles, which are the foci of infection. As the disease progresses, lesions are formed, that's ulcerations, are formed in the lungs. It is these ulcerations that will cause blood stains to flow into the sputum, so that when an infected person brings out sputum, you see blood stain in the sputum. Now, the lesion so formed in the lungs of infected person can be detected by X-raying the chest region of the infected person. Other symptoms include chest pain, persistent coughing, fatigue, and loss of weight and appetite. This will definitely result in the wasting of the body, which leads to gradual death if not properly managed medically. How do we control and prevent this tuberculosis caused by this acid fat bacillus, mycobacterial tuberculosis? It can be prevented by BCG vaccination. What BCG vaccination? We've been hearing people say, "Oh, I'm going for BCG vaccination." Bacillus, Calmette, and Choline vaccination. This helps in preventing the infection. So those that are vaccinated with this have lifelong vaccination against it. This vaccine increases any naturally acquired immunity we already possess. Apart from the vaccination, other methods of preventing this disease include mandatory BCG vaccination for children and babies, well-ventilated and spacious dwelling place to avoid overcrowding, thus reducing the possibility of droplet infections. Another one is by undergoing annual medical examination and chest X-ray, which help in early detection of lung tuberculosis when treatment can easily arrest it. The last but not the least is to isolate and hospitalize infected persons to contain the disease. We are done with cholera, tuberculosis. Let's take the next one, gonorrhea and syphilis, another disease of human importance. Gonorrhea is caused by a bacterium known as Neisseria gonorrhoeae. Gonorrhea is a venereal disease. Venereal diseases are sexually transmitted, and the two most common ones are syphilis and gonorrhea. The causative agent of gonorrhea, the Neisseria gonorrhoeae, is a bean-shaped, non-motile organism that affects the reproductive organ and urinary systems of humans. Gonorrhea is transmitted through sexual intercourse with the infected person, oral contact with the infected person, oral contact with the infected person of the body also causes the spread of the disease. Symptom of gonorrhea. In males, 3 to 9 days after exposure to the causative organism, Neisseria gonorrhoeae in this case, 3 to 9 days after exposure, a thick yellowish discharge occurs together with a burning sensation during urination. In women, the symptoms are often pain on passing urine, redness around the urinary opening, vaginal discharge or swelling of the vulva. In pregnant mothers, gonorrhea is dangerous as the baby's eye may become infected during birth. This could lead to blindness. In modern hospitals today, eyes of newborn baby are washed with solution of silver nitrate to prevent infection. Gonorrhea can be treated with the antibiotic penicillin. Remember, don't self-medicate. Seek medical counsel. This is just by way of learning. Syphilis. Syphilis is caused by the spiral-shaped bacterium known as Treponema pallidum. It is a more serious disease than gonorrhea. The mode of transmission of syphilis is similar to that of gonorrhea. Symptoms of syphilis. Syphilis occurs in 3 main stages. In the first stage, a small painless sore or canker appears in the penis or vulva. After 6 weeks, it disappears naturally. These early signs are often overlooked. So that some patients, when they see this thing and it disappears, they say, oh, thank God it's gone, and they relax. No. Seek medical advice immediately. In the second stage, about 6 to 8 weeks after, a non-itching skin rash appears, accompanied by mouth ulcers and wart-like growths around the anus, followed by aching pains in the lymph node regions. The diseases can be treated successfully during the first 2 stages, as the first 2 stages we mentioned. If the disease is not treated, more serious symptoms appear after 3 or more years as the disease progresses to the 3rd stage. At the 3rd stage, the bacteria invade the nervous system, causing irreparable harm. The patient then suffers from deep burning pains in the bone, ulcer or laceration of the skin, loss of control of movement, and mental deterioration. In women, syphilis also causes repeated abortions. So it's a very serious disease. And how do we control and prevent syphilis? It can be controlled by educating the people on how these diseases are transmitted, the danger of contracting them, and the effect these have on their unborn children, especially our secondary school children that wants to explore. I think if they care about their unborn children, about their future, I think they will keep this for the future. In addition, the government should provide facilities for treatment and diagnosis, and public health officers should be sent out regularly to check on brothels, see what these people are doing so as to curtail the spread of this dangerous disease. Now we're looking at the 5th disease of human importance. We'll look at cholera, tuberculosis, gonorrhea, syphilis. We'll look at the 5th one, rabies. Rabies is also known as hydrophobia, which means fear of water. The disease is fatal. It is caused by a rhabdovirus, an RNA virus. The virus enters the body through break in the skin. And how does it enter our body? When a carnivorous organism, such as dog, pierces our skin and introduces the virus into our system. This rabies caused by rhabdovirus is commonly acquired through the bite of infected carnivores. Carnivores like dog, cat, wolf, and bats, whose saliva contains the virus. Symptoms of rabies include high fever. High fever marks the onset of the infection with severe headache and sore throat. The patient shows fear at the sight of water and behaves as though he is mad. That's why when introducing it, I said rabies is also known as hydrophobia, which means fear of water. So when the virus gets into the body system of the host will show fear at the sight of water. As the disease progresses, the patient displays great thirst and crippling convulsions. Death is through respiratory paralysis. The duration is about 2 to 6 days. That's the incubation period, 2 to 6 Yes. Control and prevention of rabies. The methods of control and prevention of rabies are compulsory immunization of all dogs and cats. So all dogs owners should compulsorily immunize their dogs against rabies. Then another one is to destroy strays and quarantine animals before admitted. We should destroy stray animals, then quarantine animals before admitted into the country. So animals that are imported from other countries should be quarantined, observed before we allow them into our country. Immediate administration of anti-rabies vaccine serum should be administered to the victim. If the animal concerned is suspected of having rabies, an infected person should be isolated throughout the duration of illness. Poliomyelitis. Poliomyelitis is caused by a picanos an RNA virus. Remember, rabies we say was caused by picovirus, but this one piconavirus. So poliomyelitis is caused by piconavirus, an RNA virus. Poliomyelitis is known as infantile paralysis because it infects mainly children below the age of 5. Poliomyelitis is transmitted mainly through food and water contaminated with infected feces. It is also transmitted by droplet infection during coughing and sneezing of poliomyelitis patients or carriers. Now, who are these carriers? Carriers are those that have the causative organism inside of them but do not show the signs or the symptoms of this disease. So, to be on the safe side is to avoid all droplets. Symptoms of poliomyelitis. The disease begins in an acute manner. The child has a very high fever, suffers from headache, nausea, fits, and stiffness of the limbs. In severe cases, the poliomyelitis virus infects the nerve fiber of the spinal cord, causing paralysis of the lower extremities of the muscle of the respiratory tract. If this happens, the patient requires an iron lungs to aid him or her in breathing. Control and prevention of poliomyelitis. It can be controlled, it can be prevented by immunization with polio vaccine vaccines. Serving vaccine given orally or SAP vaccine injected into the body provide lasting immunity. Chances of total recovery are good if detected and treated early. So poliomyelitis, if it's detected on time, then and treatment given, the patient have a good chance of recovering. The next disease of human importance is malaria. Malaria is caused by a protozoa known as Plasmodium malariae. Then another species is Plasmodium falciparum. The vector for malaria transmission is Anopheles mosquito. This malaria is widespread in tropical Africa and Southeast Asia. Now, the life cycle of the Plasmodium parasite. The asexual cycle of the malaria parasite occurs in human, and the sexual cycle in mosquitoes. So the asexual life cycle occurs in human, while the sexual ones in mosquito. When an infected mosquito bites a healthy person, it introduces parasite at the sporozoid stage into the body of the healthy person. These sporozoids migrate to the liver, multiply and develop into tropozoites, which then invade the red blood cells. In these red blood cells, they divide asexually, forming numerous merozoites, which when liberated infects many other red blood cells. Now note, when it's introduced into the body, at that point it's sporozoid stage. When it gets to the liver, it moves on to the next stage, which is the tropozoid stage. And when it gets to the red blood cells, they now move on to the merozoid stage. Now some of the merozoid will develop into gametocytes. It is at this point now that when mosquito bite an infected person to get this gamete out, so that the asexual cycle takes place in the human, the host, while the sexual cycle takes place in the mosquito. The mosquito picks up this gametocyte when it bites an infected person. The gametocyte develop in the mosquito's stomach, where they produce sexually to form sporozoids. These migrate to the salivary gland and are eventually transmitted to a healthy person through its bites. So that's the life cycle of the Plasmodium. Part of it, the asexual life cycle in the host, while the sexual life cycle in the vector. Symptoms of malaria. Malaria is characterized by a cyclic occurrence of violent shaking, fever, and profuse sweating. These symptoms occur when the merozoid destroys the red blood cell, causing toxin to be released into the blood. Headache and nausea are the other common symptoms. The secondary effects are mainly anemia, jaundice, and enlargement of the spleen. Malaria can be controlled by getting rid of mosquitoes. How do we control mosquitoes? Checking around for stagnant waters, clearing grasses around where we live, then we get rid of them. Now, once we get rid of the mosquito, we know for sure there will be no vector to transmit the Plasmodium from infected person to the healthy fellow. Certain drugs can also be taken to prevent the parasite from multiplying in the blood. However, these drugs must be taken regularly. The next disease of human importance is trypanosomiasis. Trypanosomiasis is also known as sleeping sickness. The disease is found mainly in tropical Africa. The causative agent of the sleeping sickness or trypanosomiasis is a protozoa known as Trypanosoma gambiaceae. The mode of transmission is through the bite of an infected tsetsefly. Tsetsefly here is the vector. Humans, cattle, and horses are the hosts of this protozoa. Symptoms of trypanosomiasis. Clinical symptoms include fever, headache, and lethargy. The lymph glands are swollen at the neck. The symptom persists at this stage for a few months before the trypanosome move on to attack the brain. when this happens, when the parasite attacks the brain, the patient becomes emaciated and semi-conscious, giving the disease its name. So at any slightest thing, person does off. Meningitis can set in, causing death. Trypanosomiasis is more widespread in East Africa than in West Africa. The disease is fatal if not treated within 6 months. So control and prevention. Trypanosomiasis is controlled by eradicating flies. Once we eradicate the vector, we know for sure the Trypanosoma gambiense will remain in its host, and the host will die with it, and to not move on to an infected person. Another disease of human importance is body ringworm or Taenia versicolor. Taenia versicolor is commonly known as eczema. It is caused by a group of filamentous fungi known as dermatophytes. These dermatophytes grow on skin, hair, and nails of its host. Since it is a skin disease, infection is by direct contact with the affected part of the body. Now, what are the symptoms of Taenia versicolor? When the spores of the fungus land on the skin, they germinate, sending out mycelia into the skin. When they send out the mycelia into the skin, they give rise to small yellow patch which gradually spreads to all sides into a larger circular itching patch. The patches commonly appear on the face, neck, chest, and back. Control and prevention. Good personal hygiene is the best prevention against a fungal attack. So we maintain good personal hygiene, taking our bath as at when due, to wash off sweat, because sweat too favors the germination of the fungal spore when it lands on our body. Remember, I say microorganisms, they are ubiquitous, they are tiny, microscopic. So this dermatophyte, when they release their spore, the wind carries the spore, and when it lands on our body, the sweat will support its germination. So good personal hygiene is the best prevention against dermatophyte fungal attack. Then physical contact with an infected person should be avoided. So anyone with eczema, avoid such a person for a while until it's treated. Then the last but not the least disease of importance for today is HIV and AIDS. HIV is an abbreviation or acronym for human immunodeficiency virus. This HIV virus is the virus that causes AIDS, a sexually transmitted disease. So you can see the difference between HIV and AIDS. So HIV is the causative agent, just like your Plasmodium falciparum, which is the causative agent of malaria. So HIV is the causative agent of AIDS. So HIV is just the virus that causes AIDS, a sexually transmitted disease. AIDS is the abbreviation or an acronym for acquired immune deficiency syndrome. It is a disease in which the immune system of the human body is completely broken down, thus rendering the body unable to fight against disease-causing microorganisms that attacks it. Remember, in the earlier part of this lesson, we said that some pathogens, when they infect the host, they need time to establish itself, then the symptom will manifest. Then the host can get over it. and that is the recovery stage. How do the host get over it? It is the body immune mechanisms that fight against that pathogen, rendering it of no effect, so that its pathogenic property, the body will destroy it, and that agent will not be able to manifest its pathogenic property. So HIV virus here, what it does is it attacks our body soldiers. The immune system is like our soldiers, just like what the Boko Haram are doing in Nigeria. Remember, they are busy fighting our soldiers, destroying our soldiers. So when this HIV and AIDS, when this virus gets into our body, it attacks the body soldiers. The immune system is like the body soldiers that stand to protect the body against infection. So when this virus gets into the body system, it breaks down, render the body unable to fight disease-causing microorganisms, because every day we are being faced by one microbial attack or the other, but our body always comes up to the rescue, to fight and combat them. In a situation where the body cannot contain them, that's when the host will go down with the infection. Now, when this human immunodeficiency virus renders our body unable to fight disease-causing microorganisms, the microorganisms we encounter every day will now cause infections known as opportunistic infection or opportunistic disease by taking advantage of the weakened or damaged immune system of the body. As we are seated in our homes, offices, lecture hall, we're being faced by one microbial attack or the other. It is our immune system that helps in fighting it. What HIV does is it breaks down, it's weakening the body defense mechanism, so that a normal pathogen that your body could contain on a normal day, it could not contain it anymore. It cannot fight them anymore. So anything goes at that point. Everything attacks the person, and the person will go down at the slightest instance. AIDS, acquired immunodeficiency syndrome, is presently the most deadly sexually transmitted disease. Now, when one is infected with HIV, the body defense mechanism or immune cells are normally the white blood cells, especially the specific type of immune cells known as T helper cells or CD4 cells. When an individual is infected with HIV, the virus enters the body and inhabits the white blood cells, where it multiplies primarily. As the virus grows, it destroys the defense cells and other cells, thus weakening the immune system. Once the immune system loses too many CD4 cells, CD4 cells are the defense cells. They are also known as the T helper cells. Once the immune system loses too many CD4 cells, the body's defense against infections crumbles and becomes vulnerable to various disease-causing microorganisms, causing various opportunistic infection and other diseases ranging from pneumonia to cancer. Now, how soon do persons infected with HIV develop AIDS? In some individuals, symptoms of AIDS develop soon after infection with HIV. Such symptoms include decline in T cells or CD4 counts and presence of OIS, signaling aids. What are OIS? OIS are opportunities infections. So it means as soon as one is infected, or when we have a feeling that we come in contact with an infected person, the first thing to do is go for tests to be sure of our status. But remember, there's what we call window period. At the point when the virus gets into a new host, it takes about 3 months for it to establish itself in the host, and for a count, for us to have a good count. So the best thing is to go for tests and then check our CD4 counts. So if there's a decline, we know for sure something is wrong. Then seek medical counseling immediately. But in some people, the symptom takes 10 to 12 years to develop, while in few others it takes longer periods. Early medical care in most diseases is essential to prolong one's life. Mode of transmission. An individual infected with HIV carries the virus in the body fluids, and these body fluids includes the blood, semen, vaginal secretions, and breast milk. The virus can be transmitted only if HIV infected fluids enter the bloodstream of another person. This kind of direct entry can take place in various ways. Number 1, through the lining of the vagina, rectum, mouth, and the opening at the tip of the penis. Number 2, through intravenous injection with a syringe. And number 3, through a break in the skin, such as cut or sore. Usually, HIV is transmitted through the following modes. 1, unprotected sexual intercourse, which may be vaginal, anal, and oral, with patients infected with HIV. Number 2, contact with semen and vaginal secretion of a person infected with HIV during various forms of sexual activity, such as group masturbation. Number 3, unprotected sexual intercourse with vaginal, oral, and anal with prostitutes and injecting drug addicts. Sharing needles or syringes with HIV-infected person is another mode of transmission. Then open mouth kissing with HIV-infected person. Then the next one is receiving blood transfusion from a person infected with HIV. Another mode of transmission is by having tissue transplant from a person infected with HIV. So for those that go for transplant, maybe kidney transplant, whatever transplant, so the donor should be properly screened for AIDS, hepatitis, and other diseases of medical importance before we receive organ from anybody, be it our relation or close family members. Another mode of transmission is infection during pregnancy, childbirth, and breastfeeding. Then prospective pregnant women should be tested routinely for HIV to avoid mother-to-child transmission. of the virus. If test is positive, the woman can be given drugs to prevent HIV from being passed into the fetus or infant, and the woman is counseled not to breastfeed. Contact with blood, mucous membrane, infected objects such as clothing, genital secretion, and even sores of HIV-infected persons is another mode of transmission. Now, how do we prevent the virus? And how do we prevent getting infected? Several measures can be taken to prevent the occurrence of HIV, and they are as follows. The one most important preventive measure is total abstinence from all form of irresponsible sexual behavior. Total, know the word total. Total abstinence from all forms of irresponsible sexual behavior such as mutual masturbation, premarital sexual intercourse, unprotected casual sexual intercourse, and commercial sex working, as prostituting. All forms of hypersexuality conditions like sexual addictions should be avoided. Then the next preventive measure is being very faithful to one's sex partner and avoiding multiple sex partners. I take that again. Being very, know the word very, being very faithful to one's sex partner and avoiding multiple sex partners. Then third, practice safer sex through the use of condoms, especially when not sure of sex partners' HIV and AIDS status. So some people will say that's the ABC of AIDS. A, abstinence. B, being faithful. C, safer sex by the use of condom. Another way we can prevent is to avoid sharing sharp objects capable of cutting or piercing the skin, like blade, knife, clippers, syringes, and needles, with a person infected with HIV and AIDS. Avoid blood transfusion from HIV-infected persons. Avoid tissue transplant from HIV-infected persons. Then, last but not least, use sterile syringes and needles for injections. Then, how do we treat? For several years, no effective treatment could be found for HIV and AIDS. The story is different today because a number of drugs are now available for treating HIV infection and AIDS. Some of these drugs are aimed at treating the opportunistic infection and illnesses that affect individuals with AIDS. We are not actually treating the causative agent, but we are treating the opportunistic infection. You know, at that point, it opens up our body for infection. So we are treating the opportunistic infection. Moreover, many types of drugs are designed to prevent the virus itself from reproducing and destroying the CD4 immune cells and other cells that make up the immune system. Now, this type of drugs are known as antiretroviral drugs. These drugs stop the virus from reproducing and destroying our immune cells. Some of these drugs also act as inhibitors that either attack the HIV enzymes or stop the virus from entering the cells. Many people with HIV take this drug in combination, and taking it in combination form a regimen known as highly active antiretroviral therapy. In hospitals, known as HAT therapy. These drugs, if taken properly with anti-HIV treatment, is capable of reducing the amount of HIV in the bloodstream to such low level that the immune cells of the body may have room to recover and bounce back to their normal level and function. Now, as mentioned earlier, several drugs are taken to prevent a number of opportunistic infections, but not to treat the virus. By these measures, HIV and AIDS can thus be medically managed. Is there a cure for AIDS? Presently, AIDS still have no cure, yet the battle against it has been raging for some time now. Although new drugs are helping HIV carriers to live longer, healthier life, they have many problems. Now, problems of this virus. Anti-HIV drugs are highly toxic and capable of causing serious side effects such as heart damage, kidney failure, and osteoporosis, diseases that affect the bones. So, because of taking those high combined drugs like the heart regimen drugs, they can affect our heart, our kidney, and affect the bone. Then another problem is that this virus, HIV immunovirus, mutates rapidly. This makes the virus develop resistance to existing drugs, thereby causing treatment failure. Already, 10 to 20% of newly infected persons are acquiring strain of the virus which may be resistant to existing drugs. For this reason of treatment regimen, HIV patients have fixed plan of food, fixed plan of sleep to improve their health. Now, sometimes some of them do not keep to their plan, so they tend to miss their dose of medication. So this irregularity in taking anti-HIV drugs and the correct prescribed dosage creates chances for development of new strain of the virus that will be drug resistant. Even when patients diligently take their drugs on schedule and the prescribed dosage, HIV is still not eradicated by HAT, that regimen, high active antiretroviral therapy. So the best thing is to stay away from this virus. Abstain from any sexual activity. Therefore, those that are married, to be faithful to their spouse. So with this, we've come to the end of the first part of our lesson, diseases of human importance. So we will take the next one soon. Thank you, and you have a nice day.